Welcome, everyone. My name is Vijaya Jackson, and I'm Director of Healthcare at Genentech. I take delight in introducing our next presenter, Quite Beeler-Highsmith, Vice President and Chief Diversity Officer at Genentech. Quita is responsible for leading Genentech's diversity and inclusion enterprise strategy, including raising awareness and addressing barriers in clinical trial participation amongst Black and Brown communities. When segments of the population are not included in clinical trials, it is impossible to determine if therapies in question will work better, equally, or worse in comparison to the actual population study. Quita brings years of experience and commitment to her fight for health equity. And in addition to her extensive background, for the members of Delta Sigma Theta Sorority Incorporated, yes, she is our soror as well. So please join me in welcoming Quite Beeler-Highsmith. Quita.
Thanks, Vijaya. And hello, everyone. I'm going to spend about 20 minutes just talking about a little bit about the work that we're doing here at Genentech. And then we'll take the last 10 minutes to answer any questions that folks may have. So I'm going to pull up my slides here. If I can get them to come up. Well, if I don't get the slides to come up, I'll just talk through the presentation and we could potentially get them sent afterwards. Yeah, I'm having a little bit of technical difficulties. For us at Genentech, we really believe in embracing the increasingly diverse world around us. And our mission as the originator of the biotech industry is to deliver scientific innovations that drive better outcomes for our people, patients, business, and communities by advancing and boldly championing diversity, equity, and inclusion. And for us, if you go to our website, you will see that we have actually established our 2025 commitments and some bold goals that we want to be very transparent about the work that we're trying to deliver on at Genentech. And for us, we have 3 pillars to our strategy. The first one is foster belonging. And under that, for our 2025 commitments, we have double Black and Hispanic representation of directors, officers, and extended leadership. And then we also have mirror Asian representation of directors and officers because we have a large Asian workforce, but it's not translating into leadership positions. And even though we have 51% of our officers and directors are women, we still have some gender representation opportunity zones. If you think about scientists, medical directors, engineers, where we want to double down. And then under the core to our business is advancing inclusive research and health equity. And for us, we've been working on advancing inclusive research since 2017. When myself and a colleague really started to raise our voices to say that we want to have the clinical work be more representative of the patients that have the disease. And so one of our 2025 commitments is that all of our molecule teams will include population-specific assessments and inclusive research action plans. We also want to establish Genentech as a leader and partner of choice in advancing health equity. And then under our third pillar of the 2025 commitments, we want to annually commit $1 billion of our external spend to diverse suppliers like Black Health Matters. We also are asking any supplier that we have a proposal from that is over $500,000. We're asking them a series of questions around diversity and inclusion. And then we know for us, the pipeline of talent is important. And so we have an initiative called Kindergarten to Careers. And then in regards to the advancing inclusive research, here's the reality. The world is changing. And health equity, and specifically health equity, is becoming more of a priority. If you think about where we are today, the face of the US is changing. I live in California. 62% of the residents in the state of California identify as non-white. 5 states, including the District of Columbia, already have a minority majority population. And by 2025 or 2045, the US will be a minority majority population, meaning more than 50% of the people who live in the US will identify as not white. And why does that matter? Because less than 10% right now, less than 10% of the US patients who participate in clinical research are Black or Hispanic. And 88% of the genomic material available to scientists is of European ancestry, it's white. And we know that artificial intelligence is making treatment decisions, and the algorithms that the treatment decisions are being used are being fed by the 88% of the genomic material that is white. We have to begin to participate in clinical research. It is imperative to our health. And if we think about continuing reflecting on the increasingly diverse world around us, new cancer cases are popping up in low-income countries and Africa. In the US, Black and Hispanic populations will make up more than 50% of Alzheimer's disease. By 2045, breast cancer cases in the US will increase 72% in Blacks, 98% in Hispanics, and 120% in Asian Pacific Islanders. And we know that we have an opportunity to build trust. And we have done a study. What we're looking at, we asked the patients, and we just launched the second set of the study at the Atlantic Festival 2 weeks ago. And what the study looked at was over 2,200 patients, 1,000 of the general population, and 300 Hispanic, 300 Black, 300 LGBTQ+, and 300 low socioeconomic status, and meaning people made under $35,000 a year. And then we asked 400 healthcare professionals. And there's a crisis of trust in the healthcare system. People don't want to participate in clinical trials, get vaccinated or tested because they feel like the healthcare system is rigged, and that these disenfranchised and underrepresented communities only believe that 40% of them are confident that the treatment that they seek, when you're at your lowest moment, you're going to the doctor, that the healthcare system will be considerate, will be empathetic, and will fit their specific needs. And what our 2021 study found is that not only is there this crisis of trust, but it's getting worse. And the pandemic has not helped. And only 50% of the healthcare providers in our study felt that the healthcare system act in their best interest. And so what are we gonna do? I have a quote that I like to use from Mae Jemison, who is a Black female astronaut. And she said, "The future never just happened. It was created." And we have to create a new future, a future where Black patients and Hispanic patients and LGBTQ+ patients feel the healthcare system respects and values and treats them with dignity. And so at Genentech, what we are doing is we are advancing. Oh, thank you. Somebody got my slides. Can we go to the next slides? At Genentech, we are advancing our site. Can we go to the next slide? Our site alliance. And what this is, we're looking at 4 sites across the country that have a representative patient population. We're looking at the City of Hope in Los Angeles, Mays Cancer Center in San Antonio, the West Cancer Center in Memphis, and the O'Neill Comprehensive Cancer Center in Birmingham, where we're going to work with these centers and the community to enhance our opportunities to engage with the community by building an ecosystem and advancing scientific understanding and meeting patients where they are in the community. Because if you're going to engage with communities and build trust, it's got to be the people in the neighborhood that are going to help us do that. And if we could go to the next slide. The other thing that we're doing is, as I have mentioned before, is we're asking all of our suppliers that have an RP over 500,000, 6 simple questions before they can get business with Genentech. First of all, how diverse is your staffing commitments, right, within your own company? And then where are your goals? What % of your workforce is leadership and women, ethnically diverse? And then the people who are going to work on the Genentech business, what % of your staff comes from an underrepresented group? And so we're asking a series of questions, because not only do we have to make real change in our own house, but we have to make real change with others who are trying to do business with us. And so can we go to the next slide? I think I only have a couple more slides and then we can take questions. We also are, when we think about diversifying the supply chain, it's important. And so we've made the commitment that we're going to spend $1 billion with diverse suppliers annually by 2025, because we know it transforms society. The economic opportunity is important. Plus, it is great for business. And if we click to the next one, and this is just a quote from one of our suppliers, it is important for Genentech to understand the enormous impact that a partnership like this has in regards to economically, in terms of how people in the organization feel about what they do. We realize that we have the power to make a difference. And so we're doing just that. The next slide, please. And then for us, because we know that our workforce who comes into Genentech is a highly educated workforce. And so we have to be committed very early on to disrupting systemic barriers that don't let students of color be able to raise their hands and go to college to get these advanced degrees. And so we're looking at, in California, how do we enrich our K-12 efforts targeted to Black, Latin, and low-income students. We're looking at how do we increase funding, because if you can be as smart as you want to be, but if you cannot get the financial means to become a physician or a PhD, then that won't really help us deliver on what we need to do. So we're delivering some funding, and we're also cultivating relationships with historically Black colleges and universities. But we also have to raise awareness in these current medical school and graduate school programs about the need to target and treat racism in the healthcare system. And then really rethink how people get experience. We're working with intern programs right now to bring more students of color into our organization. And I think I have one more slide. And then I'll just leave you with this last quote, and then we'll take questions at Genentech. And this is from our CEO, my boss, Alexander Hardy. We are passionate about and committed to this work because we know that diversity and inclusion are the foundation for groundbreaking science, breakthrough treatments for patients, and more equitable access for all. All right, and now we'll take any questions that folks have.
We do have one question here, Quita, right now, and everyone please just put your questions in the Q&A. Does the process of engaging in inclusive research involve seeking engagement from individuals from all facets of race populations?
I think so. I mean, like, you know, really what we want to be thinking about when we think about inclusive research is we want to think a couple of things. One, we want to think about how are we engaging with the patients? Who are the investigators that are, who is asking the patient? Because a lot of times, if the wrong person is asking you and they're not coming at you correctly, you're not going to participate. But if the investigator is a person of color and they're asking a person of color, then they're likely to participate. And then I think we want to be thinking about what are the demographics of the disease? And are we including a patient population that is representative of who has the disease? The other thing I think when we think about inclusive research is we have to be thinking about the types of diseases, right? Because, if we think about sickle cell, we think about keloids, right? Things that are more prevalent in the Black community. I mean, we just now have one disease modifying treatment for sickle cell, and that didn't happen until like 2019, right? And we've known that disease has been out there, but people haven't been studying diseases targeted towards Blacks, right? And there's technically nothing you can do about a keloid. And we know a lot of times we get keloids, right? And so I think when we talk about inclusive research and engagement from individuals, we have to be thinking about all facets: the diseases that get studied, the people that get selected, the investigators, the sites, and the locations. So it's a important question.
Thank you so much, Quita. And we do have a few more questions in the chat from Malika. What is Genentech's commitment to STEM?
We've had a deep commitment to STEM. I mean, right now, last year we launched an engagement between Howard School of Pharmacy and the FDA and Genentech for a rotation. And so we're excited about the various partnerships that we got. We've been working very intensely with HBCUs and Hispanic speaking institutions to think about how we can engage more with these populations, as well as the 4 Black HBCU medical schools and in our engagement with them. So, I mean, it's deep. Let me just say that right now.
Thank you so much, Quita. We have a question from Jim. You have a few questions here, Quita. What steps should be taken to increase people of color students in research?
Yeah, I mean, I think that's one where we're really thinking about how do we start early, right? So that's why we have our initiative called Kindergarten to Careers, because we do want to start early to be able to change what a scientist looks like, so that people can see others who have these advanced degrees and know that they can become them as well. So we have a couple of projects. We have one of the projects that we have in San Francisco is called Future Lab. And so we use our Genentech scientists to go into schools with underrepresented communities, and we are engaging with them. We also have an actual laboratory that students can come to and do scientific projects that maybe they would not have been able to do. I also think that, one of the things that we are also asking these other institutions that we're working with, we're asking them to be conscious and mindful. I was just on a call with ASCO, which is the Association of Clinical Cancer Society. And we were talking about what can we do with undergraduates to really help them move into medical school and then help them move into oncology practice.
Thank you. Thank you so much, Quita. We have a few questions. I'm just going to combine a few of these here.
Okay.
There are diverse suppliers, and they would like to know, what type of suppliers are you looking for at Genentech, and how can they connect?
Okay, we are looking for all suppliers. If you got a business that you think you are interested in Genentech taking a look at you, please go to our website, gene.com, and that's GENE.com, and just look up suppliers. or maybe I can send something to afterwards, and we can, but there's a link on our website where you could put in your information and join our list of suppliers.
Great, and I will share another question. You have two people asking about clinical trials and how do you look for your investigators? And are you making sure you have people of color as investigators?
Absolutely. So one of the things, and I don't think the slide got to be shown, but one of the things that we just launched this year is the Advanced and Inclusive Research Site Alliance. And the reason that we launched that site alliance in LA, in Memphis, Tennessee, in Birmingham, Alabama, and in San Antonio, Texas, was because we wanted to go to places where the investigator population at the center was being led by a diverse cohort of doctors, as well as they had demonstrated that they could enroll a diverse cohort of patients, right? So they had proven the null hypothesis that it can be done, because there's a lot of fake news that says patients of color are not going to participate in clinical research, but they will participate if it's done in a respectful manner. But which is why we wanted to go to institutions where we knew that there would be Black and Hispanic investigators leading the work and the efforts. And so we're looking to expand that. We just started with our first 4 this year, but certainly we're looking to expand that to more as we move into next year and the year after.
And I just want to let everyone know, you see from Whitney Ellis in the chat, if you're a diverse supplier, you can register at that link. So
thanks,
please,
Whitney.
Thank you.
That's why I need Whitney on these calls. All these technical difficulties she would have helped me with.
We have another question here. And you spoke about this a little, and that was communities to help. How are communities, or how are we as Genentech working with communities to really help bridge the gap? They said you shared a little. Can you share a little more about making sure that all studies are inclusive?
Yeah, I mean, I think the thing that we are working on it. One of the things I have said to the company, the 3 Bs, you want to engage with communities of color, you need to be at the bishop, at the barbershop, and at the beauty salon, right? Like, we're getting information there. And so how do we begin to engage where people are? And we're starting to do that in our site alliance locations, that we're taking that type of community approach where we're engaging with community leaders to be able to talk about the value of clinical research. The other thing is we have done the health equity survey that we did in 2020 and 2021, because one of the things is we've got to get a message out about why people are not interested and what the data shows us. And we are a data-driven company, and what the data shows us is that many disenfranchised patients don't trust the healthcare system. So it is going to be hard for us to engage people who don't trust the healthcare system until we start to have more dialogue. But we've got to be able to explain and understand what the concerns are. So, which is why we're doing, why we did our survey and launched it at the Atlantic, so that we can begin this dialogue and have this conversation and be on these types of platforms so we can get the message out.
Thank you so much, Quita. Right now we have one more question in queue. And everyone, I just want to make sure you're able to see this as well. Quita, they are thanking you and saying this was an amazing presentation. So I wanted to make sure you were aware of that. One individual is sharing how many people feel that organic chemistry, some of this coursework is very rigorous. And so where people began their pursuit to attend medical school or other medical careers, they've then lost confidence. With the STEM program and other programs that Genentech may be working with, how can Genentech help instill that confidence into people of color?
Yeah, I think that is very important. So I think a couple of things. One of the things is we've got to raise awareness about the challenges students of color face when they are going to these advanced programs, especially because it can be lonely. My daughter is, she is a HBCU graduated from Howard, and now is at VCU in the genetics program. And, you know, here's the reality is, she's like the only Black person like in the program. And so I do think we have to think about our young people of color, and you know, think about the inequity of who and the privilege that happens for some students of who gets sponsorship, who gets mentorship, who gets to go into these programs. And I think that we have to also surround them up and think about, you know, our students of color, do they feel like they belong? Do they feel like they're being treated fairly? And I think so for us at Genentech, part of that is, you know, we're trying to do our part with funding. We're trying to do our part with internships and so funding like scholarships and so forth, but like internships and giving them an opportunity to come to Genentech to get some experience and be a part of a research team that will allow them to be able to contribute. So, I mean, obviously we can do more, but certainly I do understand that it is challenging oftentimes for young people of color to pursue careers in science.
Thank you so much, Quita, everyone. Are there any more questions? If so, just place them right in the chat. Okay. Quita, I think we have answered all questions. And like I shared, the chat continues to read, great presentation. So people are very excited about the information you shared, very informative. And we would like to thank all of you that are listening today. Just thank you for attending, and thank you so much, Quite Beeler-Highsmith.
Bye.
Bye, everyone.